Getting into conversations for this morning, that's what we're going to do. Our Healthy Friday conversation. This is one for the men, and I think necessary at any point for us to then be able to do. All right. Joining us this morning for our Healthy Friday conversation is Dr. Venkatesh Narasimhan. He joins us this morning. He is a consultant cosmetic dermatologist at the Aga Khan University Hospital. Dr. Good morning.
Good morning.
How are you doing?
Pretty good. How are you guys doing?
Well, we're doing all right. Karibu Sana. We're going to get into something that most people are saying, okay, how important it is. And we were just talking with Joseph earlier that for men, when it comes to skin, it is that you oil where you see after you're dressed. And perhaps there is a little bit more to that than we would like to admit.
Definitely, yeah. So
I want to actually, before we get into it this morning, want to welcome you with today's proverb. We put you to work. We go to a different African country every week.
Right.
At the end of it all, we see that we get proverbs from them, and then we would like to hear what your interpretation of that particular proverb would be.
Sure.
So this proverb today says this: only a true friend knows your real worth. Only a true friend knows your real worth. How would you interpret that?
Oh, wow. I would say, yeah, that's someone who sees you just not for what you can offer them, so knows you beyond your value as someone who can offer them advice, only not when you're doing too well, but they can step in to help you out at times when you're going through things.
Yeah.
So they don't step away at that point. So they don't only see you for your benefits, but ride through like your tough times with you.
Absolutely. Oh, that's great.
Yes.
Okay, so let's get into this thing on skin. We know that it's the largest organ.
Yes.
And why would we want to look at it specifically for men?
Well, in general, like you mentioned, men tend to neglect a lot of like things associated with skin. At least it used to be more common in the past, right? So, and as you said, skin is the largest organ in the body, and it can speak to you in terms of if you're dealing with systemic issues. It does show up on your skin first, right? So things like eczema is a skin-related disorder in itself, wherein you can have certain practices that help you keep your skin in check. You don't look, like you said, ashy, or you're only moisturizing areas that you're primarily seeing. So if you have like general care practices, your skin, you can take care of your skin better. And if you have systemic issues, let's say if you have things like type 2 diabetes or you're pre-diabetic, it can show up on your skin as focal areas of pigmentation. So usually we see people with darker pigmentation around the neck, sometimes focal pigmentation on the face, or a lot of like skin tags or things like that, which can indicate that we might want to look for certain factors systemically. So that gives you a clue then to take care of more things than just looking at your skin superficially.
But Dr. Welcome to the situation.
Thank you very much.
Old age wisdom dictates that men do not have skincare issues. You know,
Right.
A simple dash of water and oil gets you sorted. But I hear you when you talk of medical conditions that do not discriminate on gender.
Yes.
So men also become part of that lot that needs medical care. And what would warrant a man to pay attention to their skin condition enough to even to seek to medical attention?
Yeah, usually we don't see them coming in on the first episode of something they have. It's usually something they're trying to deal with by themselves, had it for a long period of time, tried measures like old household measures, things like that to try and help themselves. But usually after a period of trial and error, we end up seeing them. So it's usually things that are bothering them in terms of like, is it a painful lesion? Is it something that's very itchy? Is it something that someone has looked at them and said, okay, like what is that? What's going on with you primarily? So we see things on like the scalp, commonly like at the back of the scalp, especially in African men in relation to like post-shaving, you get a lot of like razor bumps on the back, which is called acne, keloidal nuclei, depending on if you're developing like scarring on the area primarily, or you see pseudofolliculitis around the beard, right? If you're trimming and shaving practices are not great, you see that. A lot of eczema and atopic dermatitis, a lot of acne, things like that. And nowadays, of course, back then, I would say people weren't really putting themselves out there in terms of like social media or like your or where you are in terms of like your lifestyle or your line of work. Recommends you to be like seen more or things like that. You're interacting with people more. So it warrants them to then come in to treat these things, either because of just like the fact that it's painful, uncomfortable, or people just like commenting on what they're dealing with.
Right. And if we fast forward now to modern living, you know, we're looking at there's a whole lot of changes that has happened from diet. Apparently, there's a correlation between the gut and the skin.
Yes.
It would be interesting to hear what you have to say about that. But then there's also the flip side on now. When it comes to taking care of ourselves, we need to use maybe lotion or all these products are out here and they're certified as safe, but then not for everyone. How does one get to pick and choose?
Okay, definitely. So let's walk through like the first part, of course, this thing of lifestyle and like gut health in relation to the skin, right? So of course our lifestyle has dictated a lot of what we see in like common conditions, basically, right? Like I mentioned, like pre-diabetes or diabetics primarily are on the rise, and the numbers are on the rise from the past. Why is that? Primarily more sedentary lifestyles, more refined sugar products in your diets, more ultra-processed foods, things like that, which then correlate to the rise in the levels of pre-diabetics and diabetics, which then can affect your skin in the ways we previously mentioned. So that is one factor for sure. And coming to the second part, primarily, like gut health, we're still trying to understand that better. There is a connection between the gut and the skin. Like in atopic dermatitis or eczema per se, we do have like certain publications that state that more probiotics in your diet can help, but we're still trying to figure out how much, like how true that can be. So we do have that in terms of studies out there, but it can also influence other things, like in relation to acne disorders and the gut. If you're taking very like heavy milk derivative products, it can influence your acne. If you're taking things primarily which are high glycemic index, meaning very calorie packed and nutrient less, those can also influence acne per se. And adult acne, especially in women above the age of 25, is most commonly correlated to something called polycystic ovarian syndrome, the primary pathology of which can be mild insulin resistance. So insulin resistance, again, is like what is the start of like type 2 diabetes or pre-diabetes, right? So these are all influenced by like what you're putting into your gut over a period of time.
Okay. So I wanted to go back to one thing that you had mentioned, like the razor bump issue with a lot of men, is that then you try to be very cautious. Are razor bumps all ingrown hairs, or are they caused by something else? And then how can you because some folks really have a problem with them. And I know that I've said, then I'm going to keep my beard there, even if I don't want to have it. He would keep it, or they would keep it there so that they don't have to suffer the consequences of the bumps. What is the cause of that? How can you actually have that sorted?
Definitely. It's also the nature of hair, right? So if you have more curly hair, like primarily around the beard for some people. That when you do shave and the hair is then trying to grow back out, it gets lodged underneath the skin and causes inflammation around that hair follicle, which is why it's called pseudofolliculitis. Folliculitis is like an infection or inflammation of a hair follicle. So this is like
what we call an ingrown.
Yeah, pretty much.
Okay.
So like pseudofolliculitis, right? So that is something quite common that we see in the beard area. So what are things you can do to kind of help that is like warm compresses on the day of the shave and for the few days after the shave. So take a clean warm towel, dip it in like lukewarm water, wring it out, apply it over the area just to help soften the hair over the area, open up like just for a short period of time. Your pores are slightly more open up. It's easier to shave primarily, and doing very close shaves and like getting like zero shaves on that area makes you more prone to it. So you'd rather use a trimmer instead and not do your skin level shave that often or that frequently. But if you do that, using warm compresses on the day of the shave and for a few days after can really help. But if it kind of persists beyond that and they're like inflammatory lesions, then you can definitely go see a dermatologist and they'll probably start you on like topical antibiotics or systemic antibiotics if it's pretty bad. Yeah.
Okay. There's also this that says, when you start to pay so much attention to the skin, that's when you now see these problems. When you just let it do its thing and you will not have any problems. But then you start applying things and you start doing this, 7-step routine. That is what brings about the problems. Is that a myth? Is it true?
That is true. Like, of course, I wouldn't say neglect it until you see something. You can take care of it in ways that don't involve a 7-step routine. So I think we skipped over the fact that what do you use then? Like basically, so if you're someone in general, you don't have too many skin issues, skin conditions, what do you generally need? You need to cleanse your skin and you need to moisturize your skin as the bare minimum. And if you're someone primarily who like has an outdoor job or primarily you sit next to big windows, you drive a lot, you can add a sunscreen on top of that. Now, moisturizers for the face and the body kind of can't be the same for most people. And now why is that? Primarily on the face, you have a lot more oil glands or sebaceous glands. So you have more oil production. So you can't add a heavy moisturizing cream on the face, which will further kind of clog it. Unless you're generally someone who's otherwise like has a history of eczema, like very bad eczema, then you can generally use the moisturizer for the face and the body as a similar one. So on the body, you don't have those oil glands. You will generally tend to be drier. So you need a heavier kind of moisturizing cream. Right.
And, there's a popular coined phrase, dry skin.
Yes.
Which gets people now to go for, as you say, these moisturizers and lotions. Is dry skin a condition? Because you say there's a lot of oil glands around the face.
Yes.
So how does one get to know for real that this is a dry skin and perhaps I need to moisturize or oil better?
Of course, there are signs, right? So like you see like that ashy look that people call, right? Like on the body primarily or sometimes on the face. It can appear as sometimes dry white patches, like lighter than skin color. It can appear as like fish-like scales, sometimes on the legs, looks pretty dry. There's various ways it can present at dryness of skin, right? So it's not always like one kind of like physical trait that gives it away, but there are usually signs. And of course, dry skin is one thing, which we just call xerosis as a medical term. And then you can have underlying eczema, which means you have dry skin, but you also, so your skin barrier is not as intact, and it can be triggered to have inflammation and make it like itchy and more scaly and painful for individuals with a history of eczema or atopic dermatitis. And that, depending on the age group, can present in different ways. In young children, the distribution is different. It can be over the neck, the body, trunk, things like that. In adults, it can be just over the folds, like elbow creases, behind the knees. So it is something that can present differently, but these are like a few of the maybe signs or symptoms. And if you feel like you're battling with it, and for a long period of time and are not able to really take care of it by just using an over-the-counter moisturizer, then definitely might warrant going and seeing someone. But there's also general like care practices that you can do as an individual with a history of dry skin. So we usually advise things like lukewarm water showers. So don't do too like very hot showers, don't do very cold. Either extremes are drying for the skin. Do short showers, primarily in and out in like 8 minutes. Use a very mild soap, so it's not too, it's not stripping your skin of like your natural factors. And then moisturize as soon as you come out of the shower. So within 3 to 5 minutes post shower, moisturize. So those are some of the like general like lifestyle factors in terms of like bathing rituals that can help.
How?
Interesting.
Okay, sorry. How? To what extent does what you put in then play with what then presents on the skin, especially the face here? Well, actually, we can say the face, but then throughout the body. Yeah.
So, of course, now we see this trend of using a ton of products. Now, can that damage your skin, or can that influence then an inflammation or irritation or something then you see on your skin? Definitely. So we don't need so many products, right? We need a few products to use consistently. Like we mentioned, something to cleanse, something to moisturize, something to protect yourself from the sun if you're primarily outdoors or like driving a lot or things like that. Now, when you add all these additional things, yes, it can help if you have an active like skin condition that you're trying to improve, treat, or you're trying to have some anti-aging ingredients in your skincare to help. But if you overdo any of it, it can present in different skin conditions, things like perioral dermatitis, acneiform eruptions, things like that.
Now, someone is wondering. We keep talking about the face because a lot of skin is around the face. I guess we
see it most.
Is what is also seen most about a person in the first appearance. You just look at their face, and then you could say, okay, a few things you can deduce from that. But someone is wondering, how do I deal with my habitual tendency of pricking, maybe just a slight pimple, and then this develops into scars, black spots. It just exacerbates the situation.
Yes. So that is something, we tend to try and educate patients on as much as possible.
Right.
It's definitely not helping the healing process or the lesion resolve quicker. Can you induce more scarring? Yes. But in general, for pigmentation, so in skin of color, any inflammatory lesion will always heal with pigmentation. So that's called post-inflammatory pigmentation. So you can treat that with certain topicals and things like that, but squeezing it or picking at it frequently is not really helping. On the other hand, in lighter skin tones, like inflammatory lesions heal with erythema. So that's called post-inflammatory erythema. So for them as well, they have a sequel of that inflammation, but it doesn't present as pigmentation. So again, but picking in either of these people is not really helping. It can lead to worse off scarring, and you're not really helping your skin. So addressing the primary issue with topicals or other products, or sometimes even medication, is more beneficial than just trying to pick at it.
Okay. Let's shift gears now. In your practice,
Yes.
Because there are these medical conditions, extremes, maybe young children or boys or elderly men would present. But generally, how acceptable is it, according to your view, for men to just walk in and say, I'm not sick, but I think I need attention for my skin? That has been for a long time seen as a reserve for women.
Yes.
And the one who will come forward. How acceptable or how popular are you finding men really embracing this modern way of self-care? Because it is self-care.
Yes.
And it is a health approach to better living.
So definitely we're seeing it more and more. Like the trend of people walking in just to discuss like what they can do or how they can help themselves with like skincare or body care primarily. Of course, like the older group of men usually are coming in with their wives who are in for a consult, and then they just point out like, you need to help him out. Like he's not really going to come back here. The wife is like pointing it out, saying he's been dealing with this thing forever. Could you like see this and examine and help him out? So, but the trend definitely has been on the increase, where we see men come in just to speak about how they can take care of their skin better.
Yeah.
Definitely more the face than in general the whole body. Then as you probe, sometimes they have other things that you can kind of help them with. But it is on the uptick, people coming in to discuss these things.
Okay. So what are some of the most common things that you see that need attention when it comes to skin, whether it's infections, conditions across board? What are the most common ones and how are you dealing with them?
Okay, so the most common ones, I would say primarily acne, or in all age groups, starting from like puberty onwards to like adult acne. Eczema and atopic dermatitis, starting from like infants, young children, again through teenagers and adults in some cases. We also see infections like bacterial or fungal infections, primarily things that are called pityriasis versicolor or tinea, sometimes presenting on the body or the scalp. We see other chronic inflammatory disorders, things like psoriasis or lichen planus. Those are inflammatory disorders that we kind of see. We see a lot of like pigmentary disorders like melasma, and a lot more of like these like skin conditions. In general, as to how we deal with them, of course, you kind of have to tailor your treatments depending on the patient, the age group, the accessibility, what they're currently doing, their, again, diet, lifestyle, some systemic factors. So there's a lot that goes on trying to kind of manage each of these conditions. But we did speak about a few things that you can do, like if you have a history of eczema or atopy, what do you do when you're in your daily like showering practices? If you have acne, definitely not helping pick your acne, and we spoke about a few dietary things that don't help acne. But I would advise that definitely, if you've been battling with something, any of these conditions or other conditions, go see your dermatologist, discuss it with them before you're trying a whole host of products or a whole host of things, just to give you some clarity on how long it takes to see any visible results, how many products do you need, how frequently do you need to use them, how do you use them, and things like that.
Okay, just before you go to a break, you talked about melasma. What's that?
So that is a pigmentary condition, very common in women, primarily usually starts around your late 20s, early 30s, and can persist beyond up to like menopause. So it's a very refractory condition, very difficult to kind of treat. It's primarily a cosmetic condition. It doesn't cause you an itch or pain or anything like that, but it's like a pigmentary disorder that presents across the face in different patterns, sometimes on the nose and the cheeks, sometimes on the forehead, the chin, and other areas. And it really, really is disturbing, like the mental peace of a lot of women, right? So it's something they battle a lot with. So what are some of the factors that influence that? Hormonal changes, sun exposure, blue light exposure from your screens, TVs, things like that. Extreme heat can influence it. So if you're in a very hot kitchen per se, for like you're a chef or someone who works in a very hot kitchen, that can also influence it. Sometimes systemic disorders, if you with a history of like thyroid disorders, can influence that. If you're on contraceptive medication, it can influence this condition. So yeah, it is not an easy thing to treat, and it's quite refractory. It's not something you treat once and goes away. It's kind of something you keep having to keep in check.
Okay, so let's look at that. We want to look at something a little bit more severe, and that's skin cancers. And then if we are at risk for our men in this part of the world, I mean, it's your skin, right? You wear it like a piece of cloth. You're going to keep going no matter what, unless somebody rips it off you. You're not really going to, think that it's. But again, like we said, the largest organ, and when we think about exposure to the sun or exposure to other harmful things, we don't really think about our skin first. And skin cancers have become more rampant. And we have to ask ourselves, is it because of sun exposure? How rampant are they? How serious is it?
Well, it's definitely something to consider as part of your like general health exams and things like that. We do want you to kind of keep an eye out on things that don't seem generally right or on your skin that has looked funny for a while. So it can either be moles or new skin lesions that appear not to be healing at all, like on sun-exposed areas like the face, ears, neck, or your dorsum of hands, forearms, things like that. So, of course, we are a higher UV index country. We are close to the equator, so the UV exposure is different compared to like other parts of the world sometimes. So there's also sometimes a misconception that, oh yeah, people of color, like they have melanin, they don't need sun protection, is definitely something to push back on. Yes, do you have additional protection from the sun as compared to someone who's Caucasian? Yes, but does that mean you do not have the cumulative effects of sun damage? That is absolutely false. You do need a certain level of sun protection, and cumulative sun exposure does contribute to skin cancers like squamous cell carcinomas and basal cell carcinomas, which can present as like nodules or lesions on the sun exposed area, which can be crusty or sometimes just recurrently appears to be not healing and persist for long periods of time. The incidence of melanoma is also something you want to be aware of. In skin of color, the incidence is higher on acral sites. That's like more on your palms and soles, or on your fingernails and things like that. So you want to look out for black linear streaks or areas of pigmentation that didn't quite appear before and are there now and seem to be progressing, or you're not like really sure about what it is. So having those examined, so looking at your palms, soles, and nails, which are not directly related to sun exposure, if I may add, but is a form of melanoma that is more common in skin of color than other races per se. And the ones that we look for otherwise are the ones we had talked about related to chronic cumulative sun exposure, which can be your squamous or basal cell carcinomas. Can you get melanomas elsewhere as a person of skin of color? Yes, the incidence is lesser, but that is also something to keep in mind.
Is melanin a protective element in our skin?
Yes, it is. It is. So when you do get a tan, it is protective, definitely, but it does not mean you are protected, like completely protected.
So me with my chocolate skin walking around, or Joseph walking around in the sun, there's an element of protection.
Yes.
But you can still be affected adversely by sun exposure, for example.
Yes. Like in Caucasian skin, sunburns present as red erythematous areas, which then can have blistering, peeling, things like that. In skin of color, a sunburn looks different. You just have a mild peeling of skin that happens gradually over time, and your skin appears darker. So are you more protected than a Caucasian person? Yes, but you will be affected by sun, and you will and can get a sunburn. It just looks different primarily.
Which now begs for the question. We see a lot of bleaching happening. Whereby somebody just, I don't know whether it's a peel or it's an application, but then their skin complexion changes. As that change manifests, what does it compromise in terms of now protection and safety?
Yeah, so that is something we battle a lot with, like people using like over-the-counter products to try and bleach their skin. It's definitely not healthy for your skin. We see a lot of side effects of the topical ingredients and products that are mixed into these creams sold as lightening creams. So commonly, like topical steroids of different strengths are used. Topical hydroquinone is used primarily to kind of bleach the skin. It can result in things like very bad striae, or how do you put it, stretch marks, like really bad, which can be influenced by these topical products in the long run. You can have like, you'll become more sun sensitive. You'll have like a background redness that kind of persists all the time. It thins out your skin, so you start seeing more of your like vessels on the surface of the skin. You can have like acneiform eruptions that occur as a result of using these products for long periods of time. And when you do try and wean off them, if you use them for very long periods of time, it can result in like rebound hyperpigmentation, which is called like uchronosis, especially with like hydroquinone. So that are like those are some of the things that can happen when you're trying to like lighten your tone of skin with these kind of products.
And is it reversible?
It depends on
it
depends on the extent and how long you've been doing it and what you've been using. So it's never a healthy practice. So I don't think any dermatologist in the country is marketing themselves as someone trying to like lighten or help you lighten your skin tone. The goal should always be healthy skin, regardless of skin tone. How do you maintain it to look and appear healthy, not to appear lighter?
One of our viewers is asking, because there's this tendency, especially nowadays when you go for a haircut, for men, you get your haircut, you get your shave, it washed, there's that steaming, as you're talking about the beard, management of the ingrown, and then there's the scrubbing. So someone is asking, is scrubbing safe?
So it depends, and again, it's not a uniform way that it's done across all of these like entities or barbershops per se. So excessive scrubbing is not good. So it can result in like thickening of skin, even if you're frequently scrubbing your skin.
Yeah.
Now, does everyone need to scrub their skin? Not really. Depends on what your baseline skin looks like. If it's on the drier side, you definitely don't want to be scrubbing it. If you're doing it once in like 30, 45 days when you're at the barbers and you're generally not someone who's had like sensitive skin issues, dry skin issues, it's okay. But again, I don't want to make a blanket statement. It depends on what they are using. Are they using other products when they're scrubbing? Are they just like doing a manual physical exfoliation with a few things, like a cleanser with a few like these like kind of beads or things like that that they usually have in certain cleansers, which was a thing of the past. But I wouldn't say in general for people with sensitive and like dry skin, like scrubbing is good, and even for people who are not, frequent scrubbing is not great.
Perhaps now is fine. We agree. Skincare is important. It's just the way we don't neglect a frequent visit to the dentist saves you a lot in life, you know. So any other doctor, but a skin doctor for a long time has been perceived to be a luxury unless you have an extreme medical condition. So looking into the affordability of the service, because you realize most of the insurance companies, they will, unless the serious medical condition, it will be perceived as just it's cosmetics. So how is that coming along in terms of insurance coverage and affordability of the services?
Right, we do speak to a lot of insurance companies. Like I have given a talk to them on like the common conditions that we see, how it can reduce frequent hospital visits in the future if they just have it as part of, like you said, like an annual in the annual schedule to go and see like the dermatologist. And usually dermatology consultations are covered by most insurances, primarily. Sometimes, of course, products or certain medical conditions in dermatology, they are still labeling as cosmetic, which we do give them pushback on and try and explain as to why these conditions are medical, and we are the practitioners who deal and try and take care of it. But it is an ongoing conversation with insurance companies. But dermatology consultations on a general are covered by most insurances, and we are trying to educate them on like the extent or how wide the net is in terms of like skin disorders, how many people it does affect, and who, and like you rightly said, people sometimes think that they cannot go and see a dermatologist even though they do have insurance because they think it will be considered cosmetic. But dermatology consultations are usually covered by most insurances as an outpatient service.
We talked about scrubbing and this, but then also some of the things that come into this are facials, and I know that we're primarily looking at skincare for men today, but then also the facial is a treatment that essentially you do for your skin, and that you have full body scrubs and things like that. Your skin, again, being the largest organ, but because we often apply the description of skin towards aesthetics only, as opposed to overall health. Could that be the reason why you think about a facial or seeing a dermatologist as a luxury? And then if we look into facials like that, should we all be doing them? Should we all have them done?
Well, yeah, like facials in general, right? Yeah, it is something you do as something to almost like reward yourself.
Okay.
Primarily, like people look at it that way, or like I'm just treating myself, I'm taking care of myself specifically by doing this thing. In some cases, yes, as an aesthetic treatment. So because we deal with both clinical, dermatological, medical stuff, and also aesthetic dermatology, which is just trying to improve how you look or the texture of your skin or some pigmentation or things like that. So in general, like, does everyone need to go for a facial? I wouldn't say that. So it depends on what you're trying to achieve or what your goal is. For some people, it's just like a soothing, relaxing thing that they go for. Now, who should they go to when they're doing a facial? It depends. Like spas offer facials, which are primarily just relaxing or helping you like just have like a lymphatic drainage portion of it, where they're just helping you kind of de-stress, reduce like the buildup of lymph on the face and things like that. But I wouldn't say you should be doing things with like active ingredients or active products or peels with someone who's not like specialized and qualified to do them.
Okay.
Now we have now in skin management or skincare, there is a whole tug of war between oil-based, petroleum-based products. You hear of organic products. So how now, as just a normal person in the home-based care that you mentioned that could be preventive in nature, how do we begin to gain some insight on what to consider, the basic consideration one should go for?
Okay. Yeah, that is a big thing that we see. Like what kind of product can I use as a moisturizer or just as one thing that I have in my shelf? Like I've always had it. Is it good? Should I change? Things like that. So generally, if you are someone with sensitive skin or a history of eczema, you want to look for a fragrance-free product. You want to look for a heavy moisturizer. So that is something we can say. These organic products are things with plant extracts. So it depends. We have such a wide range of brands out there. So not all of them are like formulated equally. Not all of them work the same. So there's no standardization sometimes across some of these brands. There are bigger brands that have like plant extracts within their creams that are, let's say, anti-inflammatory or more soothing, like let's say aloe vera, centella asiatica. These are some plant extracts that are included in some creams. So again, now petroleum-based products, things like petroleum jelly, like Vaseline, right? Like or Aquaphor. So it is something that's been around for years. So basically, when you apply a layer of it on your skin, it is reducing the amount of loss of the moisture from your skin. So in that sense, it is helping you moisturize your skin. So is it bad? All right. I wouldn't necessarily say that. We commonly use it even for like if you have a very superficial wound, a mild graze, things like that. If you just cover it with like petroleum jelly and nothing else, it will heal quicker over time. So again, there's a lot of misconceptions and a lot of like blanket terms thrown around, but I wouldn't say I would label it as a bad ingredient per se.
Okay. So a lot of questions are coming in now, even as our time is running up. But let's go through some of them if we can. One of them, you've mentioned this term throughout this whole conversation: sensitive skin. What is sensitive skin?
So yeah. That is something that can present in very different ways. Like someone with sensitive skin through their life have the experience with skincare products or topical products has been one wherein when they try a few more things than their routine, it irritates their skin. They develop like some redness around the area that they're trying to use it. It stings them more. Like your friend, like someone's friend tells them, "Oh, I've been using this thing. You should try it. It's been working great for me." And then when they put it on, they have like a stinging sensation on the first day, the second day, or the third day. It's leaving like a redness on the area. You're peeling from it. You're having like flaking of the skin, things like that. Like sometimes things with a lot of fragrance, which is labeled a moisturizer, for someone with sensitive skin, can end up inflaming their skin, which is like almost counterintuitive that you're using a moisturizer and you are then having a skin flare up, right? So it's mostly because of the fragrance. So yeah, it presents in different ways, and like for people who have been trying to lighten their skin with like these bleaching agents, they end up having very, very, very sensitive skin. So even the mildest sun exposure leaves them looking flushed and red like through the day. Any active based product further causes them to have like again irritation, peeling, and things like that.
Okay. So then, it's great because you give words that get us to the next question. So even with lightening, again, that you've mentioned, so there's another concept called brightening. What's the difference between lightening and brightening, and is one safer, better than the other?
Okay. So brightening is, so people usually talk about the glow, like you have a glow, you look bright. So what does that really mean, right? So just when you have a uniform skin tone, like more uniform, like across the whole face, how the light hits your skin, how it's reflected is what gives you that glow. So it's basically when you have a more even tone, the reflection is perceived better. Right, so that is, you can say, brighter skin, right? You're not trying to lighten it. If you have some blotchy areas of pigmentation, you're trying to just get it more even with the surrounding skin or your general tone. And that then you can call like looks brighter, or you do have like a certain glow per se.
Okay.
So that I would say is something as a better goal to have than to say lightening skin.
So brightening better than lightening.
Yeah.
For men, because today's Men's Day.
Oh, sorry.
There's this condition that I've seen men develop at the back of the head from the shave.
Yeah.
What is that, and how can it be perhaps managed?
Yeah, so that is again a tougher condition. Like we mentioned, like again, it's a similar concept to what we talked about for the beard. So very close shaves to the skin in that area for people with a tendency for that condition. It's called acne keloidalus nuchae, wherein they develop keloidal scouring or raised scarring on that area because of repeated inflammation of the hair follicles there. So avoiding clean shaves in that area and trimming the hair instead without like using a zero trim, or so trimming the hair, leaving a length of hair above the surface of the skin without completely clean shaving it is better. Warm compresses on the day of the trim, and for a few days after can help. But also, just if you're someone who's battled with that condition, just go in and see your dermatologist so they can give you some prescription topical medication that you can use every time you go in for a trim. So you kind of keep it in check.
Right.
And if you do have already like scarring in the area, which is either raised keloidal scarring or hypertrophic scarring. Usually, if you look at any scar you have, you will not have hair growth through it. So you lose hair on the site. So now to help improve the appearance of the scar, you can kind of flatten it with certain like procedures, like intralesional injections to kind of improve how it looks. But you never want it to wait until you get there. So it's better to treat when you have
early enough, in the early stages.
Yeah.
Now, I don't know whether it's a myth, but is it would you say contagious? Because some people will say if you share a shaving, the clipper of the machine, perhaps you could get infected as well. Is that true? Is it a myth?
Well, you don't want to be shaving things that you're using very close to your skin. Same with towels, same with other like clothing, things like that. So can you, if someone has a superficial fungal infection, can you then have it across? Definitely. So that's a possibility.
Oh, ew. Would you not know? So I'm sorry.
This from the barbershop sector.
Yeah, but the barbershop, don't they do this?
They do clean. Yeah, exactly.
So
Exactly.
the spirit, the spraying of the spirit, should that be enough, sufficient?
Yeah, generally, if you're doing it well enough, in between every client, every other shave, definitely. And they do change the blades and things like that. But in general, for home use, like if you're using your friends, it's not going to be recommended that you pick that up and just do that. Okay. So it doesn't help. And of course, like these bacterial infections or folliculitis that we talk about is caused by a very common bacteria which is present on a lot of us, which is Staphylococcus aureus. It's not very hard to pick up. Right, so in general, you want to be having more like better sanitary practices when you're coming to things like shaving, trimming, things like that, where you're storing your thing, your blades, your trimmer. Are you like wiping it down? Is it just left somewhere for long periods of time? And then you just pick it up one random day and use it.
Okay, so there are 3 questions and we have 3 minutes. So let's see if we can do this in a minute per question. And I'm just going to go if it's okay with rapid. So the first one is about puffy eyes, that no matter what they do, the skin around the eyes just is puffy and you get well rested, well hydrated, but still puffy. 1. Second question is about roll-ons and deodorants. Are those good for the skin? Men especially, because that's where our conversation is. And then thirdly, shaving versus using sugar wax to remove hair. How does that affect or not affect the skin? I don't know if you're going to remember this, but okay.
All right, let's start with puffy eyes. So it depends what age group and is it something that they constantly have. Sometimes people with allergies tend to have more of a history of like puffy eyes, frequent sneezing in the morning, things like that. But as you age, you also lose something we call deep fat pads or deeper structures that then leave like a kind of hollowness in the under eye area, which is usually seen quicker in skin of color than in like Caucasian patients. That then allows for more of the fluid around your eyes to kind of stagnate there for a longer period of time. So it depends. It can sometimes be the swelling that you see. It can be the swelling of like a fat pad, which doesn't usually go away that easily. So yeah, it can be like an aging change or a result of allergies. It can be, if it's an aging change, usually related to loss of deep of structures, which then contribute to that kind of puffiness. So there's no topical remedy that I would say that can like kind of take care of that. Okay. Lymphatic drainage practices or things like that can help certain individuals, but it depends on what the underlying issue is. Number 2 was
the application, the roll-ons, the
roll-ons. Roll-ons primarily, they're usually okay, but again, for people, we do see people with a history of eczema not being able to use fragrance roll-ons. So because of the fragrance in it, it irritates their skin, and your underarm, basically a very sensitive area. It can contribute to more pigmentation if the area keeps getting inflamed. It's itchy all the time after you apply a roll-on like through the day, and then it results in like post-inflammatory pigmentation like we talked about. So for those people, you want to use a non-fragranced roll-on, or like a milder one, which kind of has antibacterial effects and things like that, but doesn't necessarily give you the fragrance.
The waxing and the shaving?
So for curly hair, it is going to be so either practice very close shaves and waxing are trickier. It can result in pseudofolliculitis, like what happens on the beard when they do shave. So you can get things like that. So we did talk about some practices that can help, like trimming instead, or if you're doing that, use warm compresses on the areas per se. You can consider things like laser hair reduction if it's something that's really bothering you for a long period of time. People tend to have the first few days post a wax or a shave, the area tends to get itchy, things like that. So you want to look for moisturizers which can help kind of exfoliate the area a bit. So I wouldn't say it depends on the area and how much hair you have there, how often you do it, what are your practices before doing it, what are the alternatives you've tried, and what can you do after to kind of take care of it better.
I wish we had more time.
Because there's so many flowing in, and you were at top of the hour. I'm sorry. We have to definitely do this again, Doc, because there's so much that people want to know, and then also for us to bring out that we don't actually ever address. So this is an open invitation.
Thank you very much.
Time.
A quick one before you come back. Where do people find you?
Oh yes. So currently I practice with Aga Khan Hospitals, and I also work with Dr. Stash Clinics at 14 Riverside. So those are the 2 places where you can currently find me.
Dr. Venkatesh Narasimhan has been our guest this hour on a Healthy Friday conversation, skincare in men.
This is The Situation Room, the only way to start your day.